Sorry. Now I'm trying to get out of. There we go. All right. So back in. Now I'll share my screen. There's a certain order I need to do this in, or it ends up being a hot mess. All right, so I'm going to get this. Do you see this polls and quiz? You can shake your head if your camera's on. Do you see this or no? Can someone turn their mic on and tell me they see it or not?
Yes.
Okay, great. Thank you. So we'll be using that in a bit. But first, some test taking and study strategies. And I know you got a lot from Lynn as well, but this is my take on it. Some studies tips, like make a plan for where and when and what you're going to study, and really get in the habit of using your calendar regularly. Like put everything on your calendar. I don't know if you've done that or not. Most of you have a phone, but put it on your phone, put alarms there so you're not late. And also, there's a lot of research that actually says to put study time on your calendar. So it's more intentional that, like, right after class, maybe you're going to grab lunch and then study. And maybe if you're going to do it in the library, it's a great place to do it, not even leave school. Studying should really be active rather than passive. So the more that you can act things out, the better. With med administration, you'll have the opportunity to do this on Monday, which will be fabulous. The more you go to the lab and you act things out and use your hands or do it at home, the more it kind of cements into your brain, and you will find yourself during an exam like acting it out with your hands a little bit, and you can see yourself doing it. So it's the kinesthetic way of learning, is that you're doing it with touch and acting it out, if you will. Study sessions should really be free of distractions. Really make it as similar as you can to an exam. So I know you're not always doing that, but you do have like test questions or these questions, like, and I know many of you may have the fundamental success book where there are a lot of questions. And if you get them, make it quiet. When you're doing them, don't have background music. Make it like the exam. The quietness of the exam is extremely intimidating, because you can be used to, studying with background music on, and it relaxes you, and you get to the exam and you don't have that thing to help you relax. It's better to study 4 times for 1 hour than it is 1 time for 6 hours. Engage your brain by making small changes as you're studying. Things like a sip of cold water, stand up, move around, get out of that sitting position, facing a different direction, having a small amount of sugar can actually, all of those can cause the brain spikes that are primed for your learning. So tips for reducing test anxiety. I know that's huge for everyone. If you don't get that nervous before the exam, good for you. Preview the testing site and the program. Check out the program you'll be using before you take the test. So have you already done that with ExamSoft or no? I don't know when your ExamSoft thing is. You have a practice test on ExamSoft.
Yeah,
There's a highlighter.
we did it. We did it already.
Great. There's a highlighter. Wow, I highly recommend the highlighter. For those that are nervous, it feels like it gives you more, it makes you more like you're in control, highlighting the most important things of the question and the most important things of the answer. For those who are going too fast and not reading every word and comprehending every word of all the answers and all the questions, it does slow you down enough to do that. Peppermint, having some peppermint candy or smelling something with peppermint scent has shown to help reduce anxiety. Limiting caffeine. So, fine if you have a cup of coffee in the morning, um, you know, but don't have 5, okay? Like, don't make it so it's increasing your anxiety and making your heart rate go up. The exam itself can make your heart rate go up. You don't need caffeine to do that on top of it. When you're, before you come, I know you won't have a dog in the class, but pet something. Maybe have a stuffed animal in your car. Anything soft. It can be soothing and help reduce anxiety. Brush your hair. 2 minutes can relieve anxiety. So obviously you're having anxiety at home while studying. So some of these, maybe they can't be done during the exam, but they can be done at home. Brushing your hair for 2 minutes can relieve feelings of anxiety just through scalp stimulation. Study consistently. The number one way to reduce test anxiety is to study consistently because you start to feel more confident with your abilities. I don't believe you can overstudy. You can't overstudy. You know when you know something, but you can over cram. And starting 1 week before an exam for these exams is cramming. So when you're starting to study for this exam is the day before the class by doing the prep work, by looking through the chapter, maybe reading some things related to the test objectives, highlighting, if you will, any pre-class assignment that you get, make sure you have done that. The more you put into the pre-class assignment, the better you will be. I had the reputation of giving very large pre-class assignments because I wanted to make sure that people were actually putting the time in before my class. And students, although they may not have liked the big pre-class assignments, if I was teaching, they knew they were getting it. And in the end, they appreciated it because it made class so much easier. The day of the exam, what do you need to do? You make sure you get there early. Now, you may not, it depends on your class. Sometimes coming into the classroom is good because maybe some people are quieter there, but sometimes they're chatty in the classroom also. In the hallway, they're chatty. What you want to make sure you stay away from are the students who proceed to tell you about their anxiety. Don't go near them. For some of you, it may be beneficial to sit in your car and just listen to music or study a little more. Set an alarm on your phone as to when to stop and go in. We had one student who, poor thing, got there early, sat in the car and fell asleep and ended up late for the exam. So that's what I'm trying to prevent when I'm saying set your alarm. All right, make sure you read the entire question first. I would highlight the most important key factors in that question as to what they're looking for. Look for absolute words like always, never, or none. Those words can significantly change the meaning of the question. Also look for words like sometimes, not, likely, or probably. These words are not absolute and can also change the meaning of the question. Now, I will be giving you a copy of these slides, so don't feel like you need to write everything down. At the end of the session, I'm going to give you a PDF of this whole slide presentation. After you've read the question, try and figure out the answer before looking at multiple choice options. So cover up that question with your hand. And think to yourself, like, what is this question asking me? And what do I think the answer is? Make sure you look to see if it's a select all that apply or just straight up multiple choice. Then read the answers and rule out the incorrect answers. Know why they're incorrect. And if usually I'll tell you what happens, unfortunately, you end up with two answers that look great. Now, you'll hear from previous students, oh, two answers are correct, but I need the best one. That's not always true. It's not true as much as you hear from students. They're 99% of the time, there is something wrong with that other answer. It is not correct. It is not answering the question. Now, the other thing can be if a question is asking, what would be the most important thing to do first for this patient? Yes, all of those answers are answers that you would actually do for the patient under those circumstances, but only one of them is the best answer for what would you do first? What should be done first? Or what is the priority nursing intervention? One of them is the priority. And remember, your teacher is the expert. So you may need to understand the rationale from them better in order to understand why that answer was the best if you got it wrong. So let's see, after you've read the question, try and figure out the answer. Okay, rule out answers that are incorrect. If you do not know the answer, choose your best guess. Another thing, trust your first instinct. Unless you realize you have misread the question, your first guess or your first question that you answered is usually your best. When I started, we were doing all paper and pencil exams and Scantron, and there would be students who would say, I got 5 questions wrong that I changed the answer. And then they would say it for another exam, and I'd say, do you want to leave your eraser on my desk? And that way, I won't hold it from you, but you'll have to come up and get it to change an answer. And maybe that'll make you think a little longer as to why you want to change that answer. Sadly, it is still an issue with students, even though you can't go back, their a first instinct may be that B is correct. I know it's right. And then, you've read everything and you hem and you haul and, oh, I don't know, maybe C is better, and you change it. That's how answers get changed with the um, electronic exams. So it is still changing an answer. It may not be going back to it after you're finished and changing it, but you have still changed your answer. Be very careful changing answers. Know exactly why am I changing this answer. Okay. Any questions for what I just went through before we start this? I won't be recording, but you will get the slides. So far, there is no question. When it comes to reading, I'll tell you, the readings really help. They really help clarify things. I'm glad you're reading, because what you'll hear from previous students sometimes is, oh, you can't read it. There's just not enough time. Well, you need to make the time. If this is a career you want to be in, you're going to need to put in a lot of effort. At the very, very least, you get the outline before you even come to class. So what you can do the night before is do your pre-class assignment, but also find every single thing that is in that outline, because you're really getting your slides only in outline form, or you're getting them slides now. We used to do outline and slides, but I think I heard through the grapevine you're getting the slides only. Is that true?
Yes.
All right. So what you want to do is find that slide in the book. Find that content of the slide in the book and write the page number on that slide where that information is found in the book. Do it for every single slide. Then that's your priority reading right there. If there's a table that is referred to, find the table. If you have an iPhone, okay, you can go to notes in your phone, go to new note, go to picture, and then when you pull up picture, you get scan document. So line that up with that page with the chart. Those charts and tables are fabulous. Line it up, scan it. It scans into your phone as a PDF. You can email it to yourself and you can print it and put it right with your notes. Okay. There are apps for this. I had one student that did it with the whole chapter and scanned it, printed it in color, and carried it with her to always refer to the notes. But it was an expensive app. But then I found out you can just do it this way, and you can scan multiple pages in a row. Okay, so I recommend doing that. So at the very least, you're going to read what I just said. Read it and make sure it makes sense. You can add to your slide in a different color or on the back of it what helps you from your reading to make that make more sense to you. Because sometimes by reading the book, it clicks better than exactly what your instructor said in the classroom. Because remember, they're giving you something a little bit more abbreviated. They're not spelling every word out for you. and it will take hours. I believe it is
God, it will take hours. She's funny as shit.
it takes hours to study. I'm thinking it was 3 hours for every 1 hour of class study time, which 3 hour class, now you have 9 hours of study time for that class only. I'm just trying to read these. Okay, so now let me get your pictures out of my way for that. And put this down here. So here's the first question. And let me end the poll. And relaunch the poll. So these are going to say single answers. They're either single or multiple. So I have A through C. I don't want to have to play around with different screens popping up. So I just need to change the title, single or multiple answer. If it doesn't say select all that apply, then it's not select all that apply. Make sense? So a nurse teaches a patient. Now, please do the poll. No one can see who you are. I can't see who you are, nor do I care when it comes to answering these. I want everyone to feel like no one can see. Okay? So a nurse teaches a patient to use visualization to cope with chronic pain. What step in the nursing process does this represent? Planning, A, planning, B, analysis, C, evaluation, or D, implementation?
Implementation.
Okay, so what I want you to do is on the poll, I want you to click your answer. Does everyone see where you click the answer?
Yes.
Good. And then when I usually give about a minute a question, sometimes a little less. So I'm going to end the poll and share the results. So as you can see here, most people pick D, and D is the correct answer. So during the implementation step, that planned nursing care is delivered. Next question. Stop. So I may be choppy when I'm reading at times because I have to move this poll all around so I can read my question. Okay, a nurse is caring for a patient with a fever. Which is a well-designed goal for this patient? A, patient will have a lower temperature. B, the patient will be taught how to take an accurate temperature. C, the patient will maintain fluid intake adequate to prevent dehydration. Or D, the patient will be given aspirin every 8 hours. So you have 15 seconds left. I'm going to end the poll. So we have a variety of answers for this that people chose. C is actually the answer. The reason is goals must be patient-centered, specific, measurable, realistic, and have a time frame.
Sorry, could you say what C was again? What answer that was?
D? Sure, let me go back. C was the patient will maintain fluid intake adequate to prevent dehydration throughout the day.
So how come it wasn't D if it has like a time frame?
Probably because we don't give aspirin for a fever, we give Tylenol.
Okay, thank you.
And the other thing, you don't just give it every 8 hours. It's usually every 8 hours. Well, it does say whenever necessary. The words adequate and dehydration are based, whoops, on the generally accepted criteria against which to measure the patient's actual outcome. And the word maintain implies continuously, which is a time frame. So one of the side effects of the fever would actually be dehydration. So in this, they're working on preventing dehydration. Is that making sense to everyone or no? Next question. I'm going to stop sharing and which should the nurse do during the evaluation step of the nursing process? Set a time frame for goals, revise the plan of care, determine priorities, or establish outcomes. Wendy, do you see the poll now?
No, I don't.
What are you on?
I'm on my
Phone?
phone. Is that why? It did pop up earlier.
Yeah.
If you go all the way on the bottom options, all the way to the right where it says more, you click on that and you see the poll.
I clicked it earlier, but it only showed me the results. But yeah, now it is showing me. Yeah. Okay, thank you.
You're welcome. So you on your phone probably need me to read the A, B, C, D, I guess.
Yeah, like I have to go back and forth. Yeah.
When the poll comes up, I think it covers your whole phone is the problem.
Right.
Okay.
Yeah, but I'm about to hop on my laptop.
Okay. It does make it easier.
Yeah, thank you.
You're welcome. I'm going to end the poll and share the results. So wow, they're all over again. Let's see what the answer is. So the correct answer was B. Revising the plan of care takes place in the evaluation step of the nursing process. If during evaluation it is determined that the goal was not met, the reasons it is determined that the goal was not met, and the reasons for failure have to be identified and the plan modified. So this was during the evaluation.
I have a question.
Mm-hmm.
Wouldn't you establish the outcomes first before revising the plan care? Like, because if you don't know the outcomes, how are you supposed to know whether to revise the care plan?
You don't. What were you taught? Do you remember? You don't start with your outcomes. You have an idea what this patient needs, but you set your goals.
Well, when you establish the outcomes, doesn't that happen in the planning step, like the where you set the goals? Isn't that what established outcome means?
Yeah, I mean, I would go back to my notes for that and like read exactly what it says in under each area to get very clear clarification for that. Because when it comes to the evaluation, the goals have been established and the outcomes have already been established, yes. So what you're doing is you're deciding, did I meet my goal or not? And then if you met it, your plan was probably good. Where if you didn't meet it, you need to figure out why didn't I meet my outcomes or my goals, and then make revisions to the plan. Does that make sense? Okay, during which step of the nursing process does it determine that which actions will be employed to meet the needs of the patient? Let me give you a new. A, implementation, B, assessment, C, planning, and D, analysis. Yes, the plan would be modified. I have questions here that I saw. Okay, I'm going to end the poll. Let me just read this question again. So it is C. The identification of nursing actions designed to help the patient achieve goals occurs during the planning step of the nursing process. And most people did put C. There were some outliers, though. Which information supports the appropriateness of the nursing diagnosis? The defining characteristics, planned interventions, diagnostic statement, and related risk factors. I'm going to end the poll. We have almost 7 of each. It's interesting. So the answer is A. The defining characteristics are the major and minor cues that form a cluster that support or validate the presence of a nursing diagnosis. At least one major defining characteristic must be present for a nursing diagnosis to be considered appropriate for the patient. Okay, which is the primary goal of the assessment phase of the nursing process? A, to build trust. B, to collect data. C, establish goals. And D, validate the medical diagnosis. So again, which is the primary goal of the assessment phase of the nursing process? I'm going to end this. So pretty much everyone put A. I'm actually wondering if the person put B. I'm wondering if the person that put A actually meant to put B. The primary purpose of the assessment step of the nursing process is to collect data, which would be information from various sources using a variety of approaches. The nurse collects information about a patient. What should the nurse do next? A, plan nursing interventions. B, write patient-centered goals. C, formulate the desired outcomes. D, analyze the collected data. end the poll. D is the answer. After data is collected, it is analyzed, and that's where your problems emerge. The nurse evaluates the patient's response to a nursing intervention. To which aspect of the nursing process is this evaluation most directly related? The goal, A, the goal, B, the problem, C, etiology, or D, implementation. So the answer is A. There was a smattering of results here. To evaluate the effectiveness of a nursing action, the nurse must compare the actual patient outcome with the expected outcome. The expected outcomes are the measurable data that reflect goal achievement and actual outcomes that really happened. Does that make sense to those who didn't get it? The nurse concludes that a patient's elevated temperature, pulse, and respirations are significant. Which step of the nursing process is being used when the nurse comes to this conclusion? A, implementation, B, assessment, C, evaluation, D, analysis. And the poll. The answer is D, analysis, because during the analysis step of the nursing process, data are critically explored and interpreted. Significance of data is determined. Inferences are made and validated. Cues and clusters are compared with defining characteristics of the nursing diagnosis. Contributing factors are identified, and nursing diagnosis are identified and organized in an order of priority. Nurses collecting subjective data associated with patient anxiety, the patient's anxiety. Which assessment method should be used to collect information? A, observing, B, inspecting, C, auscultating, or D, interviewing. So the key points here are what I would have highlighted in the question are subjective data. That's extremely important. patient's anxiety, and assessment methods. I'm going to end the poll. D is the correct answer, in that interviewing a patient is most effective data collection method when collecting subjective data associated with their anxiety. The patient is the primary source for subjective data about beliefs, values, feelings, perceptions, fears, and concerns.
Could you show me the answers, the other answers for that question, please?
Sure. So it was observing, inspecting, auscultation, and interviewing.
Okay, thank you.
You're welcome. So now we're on to health promotion and disease prevention, the concept, which is very broad. No. So to increase quality of years of healthy life, Healthy People 2030 focuses on 4 areas. One of those areas is, which one here? Allowing people to continue current behaviors to reduce the stress of change, focusing on individual health changes that will lead to better communities, creating social and physical environments that promote good health, focusing on illness treatment to provide fast recuperation. Now, in one of these answers, there's a key word that made me knock that answer right out. In fact, there are two of those that had keywords that made me knock the answer out. To end the poll. So the answer was the one that created social and physical environments that improve good health for all. So that was C. So let me go back. Computer does not like to go back. The word only caught my eye immediately. Okay, it's very, whoops. That made me not want that answer at all. Does everyone see that? That it's too narrow? And the other word was illness. Because what we're doing is this is healthy people. To be very, very broad, we're trying to do everything we can to keep people healthy, right? So we're really trying to prevent disease. So to focus on illness and treatment to provide a fast recuperation, our focus is on the wrong thing. Um, but yeah, we are focusing on individual health changes that will lead to better health for people in the communities, but only is what immediately caught my eye before I even finished reading that sentence. And then there are your other goals. You can read them yourself. Okay, the nurse is working in a clinic that is designed to provide health education and immunization. The clinic is designed to provide primary prevention, secondary prevention. So A is primary, B is secondary, C is tertiary prevention, and D is diagnosis and prompt intervention. I'm going to end the poll. So primary prevention is the answer, and it precedes disease or dysfunction as applied to people considered physically or emotionally healthy. And everyone got that right pretty much. The patient is admitted to the emergency department of a local hospital from home with reports of chest discomfort and shortness of breath. The patient is placed on oxygen, has labs and blood gases withdrawn, and is given an electrocardiogram and breathing treatments. What level of preventive care is this patient receiving? Primary prevention, secondary prevention, tertiary prevention, or health promotion? Sorry. Like I see a mistake, I want to change it. Just gases needs 2 S's. That's all. To end the poll. And here the answer is secondary prevention. And it focuses on individuals who are experiencing health problems or illnesses and who are at risk for developing complications or worsening conditions. So the activities here are directed at diagnosis and prompt intervention.
So tertiary prevention is I mean, it says it right there, but like it's when the symptoms are already like too advanced to get rid of.
Yeah, exactly. More long-term care disease, long-term disease and disabilities. So there, instead of trying to get rid of the disease, what you're trying to do is prevent complications and further deterioration from that disease. Okay,
Can you just go back to the question real quick? I'm sorry.
sure. No problem. Come on. Okay. There you go. So a patient is admitted to the emergency department.
Okay,
Reports
also, so I put a quick question. So it says is given an electrocardiogram and breathing treatments. So why would we give them treatments if like they didn't have something already in place? So like I'm just confused why it wouldn't be tertiary, because like what we were like really essentially taught is the tertiary is they like already have a problem and you want to prevent it from like worsening really.
Let me see.
Because
The
I don't
correct
understand it.
answer was B.
Yeah, it was secondary.
Yeah, no, I'm just saying like
I
why.
think tertiary is more so like them having medication prescribed and you giving them medication like teachings and stuff like that because it's already something that was diagnosed and now you have to treat it with medications. That's tertiary.
Yeah, I think she was saying like tertiary basically ends up being like a chronic disease, like something that you can't really cure. You're just
That's
trying to
something that you have to treat with medication.
right, but you're not going to get rid of a tertiary. Like tertiary prevention is
Right.
where you're
Yeah.
And
preventing the symptoms.
this isn't saying the patient has shortness of breath and chest discomfort. So this isn't saying that there is something chronic we can't get rid of. It's saying that here are their symptoms. It doesn't give you a long-term disease or anything. So
Yeah, I'm just like
they're
because
getting
like the secondary,
oxygen.
I remember just like remembering that secondary we were taught like it's screenings like um the early test detections like stuff like that, whereas the tertiary like I'd understand like if it's not saying they're receiving treatments, but like that's the part that like confuses me, because even if we don't know if it's like impreventable, like that information isn't really provided. So what would you say like could
If
really
it,
distinguish secondary versus tertiary in this case?
um, if the patient came in with COPD, chronic obstructive lung disease, then we're not going to fix that. We're going to treat the symptoms. But this patient, we don't know an age. It could be someone young that, or a 40-year-old that has chest discomfort or shortness of breath. So we don't know if this is, what is the worst, what's going on here, or they're having shortness of breath. Is the chest discomfort related to that? Or is it real like chest pains they're having? So they're trying to figure that out, like what exactly is going on. So we're going to give them oxygen, and they had labs done and blood gases done to see what their oxygen level is. And they're also doing an EKG treatment, and they're also doing nebulizer treatments. Let me see the. So this is someone that is experienced a health problem or illness who's at risk for developing more complications or worsening in the condition. So it could be asthma, I guess, is chronic, but it could go a lot worse if not treated. It's not a permanent disability that the lungs are reversible with asthma. So you give that neb, even for someone COPD, you're going to give the neb, but we don't know if the person's even having a heart attack here.
So I have a question. So
It's not irreversible. Go ahead.
for this, so secondary wouldn't be, so the disease has to be named for it to be tertiary prevention.
Well, it may say that they have, yeah, pretty much. Like it may say that, I don't like to be that black and white. It could be that they had an amputation and they're feeling pain related to that amputation in the toe that's no longer there or something. Like where it is a permanent and it is reversible, but we would try and minimize the effects of that. I wonder if I have a slide on a tertiary. It's been, I looked at them, but I don't remember now. So here we have a patient admitted to a rehabilitation facility following a stroke. Okay. Patient has right-sided paralysis and is unable to speak. The patient will be receiving physical therapy and speech therapy. What is this an example of? So I think this question is going to help to answer your question. I'm going to end the poll. And here's your tertiary. That help clarify it?
Yes.
Good. Okay, here's sleep. A nurse observed some involuntary muscle jerking in a sleeping patient. The nurse determines that the patient is most likely in which stage of sleep? A is stage 1 non-REM, B is stage 2 non-REM, C is stage 4 non-REM, and D is REM. Gonna end the answer is A. Involuntary jerking occurs in stage 1 non-REM sleep. In the other stages, the muscles proceed from a relaxed state to a large muscle immobility. So you want to review your sleep stuff. Okay, MedAdmin. So you have not had a lab. Have you had any lab for MedAdmin?
No.
Not yet.
Okay. All right. So you've learned it. Now there are some injections in this that I know you have not learned. Normally I would be doing this next Wednesday, but I will be away. And that's why I had to do it earlier. So this one, the nurse should provide which teaching point when administering an enteric-coated oral tablet to a patient. Chew the tablet before swallowing it is A. B is break the tablet in half before swallowing it. C is allow the tablet to be absorbed under the tongue. D is swallow the tablet whole after double checking the dose. I'm going to end the poll. And the answer is D, to swallow it whole after double checking the dose.
Wait, so with the REM sleep, it's not REM. With jerking, I was a little confused about that.
That's where you're so deep, you're almost paralyzed.
But in the PowerPoint, it did said that the brain is highly active, so the body does tend to jerk when you're asleep in REM sleep. So
PowerPoint
Is
also
that
says
is jerking different from twitching? Because that's what the word I thought it said was twitch.
in
Is
stage one on the PowerPoint, it says that you're drowsy and relaxed. So it doesn't say anything about jerking or twitching or anything like that on the PowerPoint.
Whoa, I'm going.
right, and it mostly talks about muscle movement in REM sleep.
So the stage one is that if that is the dream state, is that the keyword we're looking for?
I don't even think stage one is the dream state.
No, I don't think stage one is dream. It's
The
just
lighted state. Yeah.
I'm not positive there anymore. It's when you're starting to doze off is stage one non-REM. But in the other stages, the muscle really proceed from a relaxed state to a large muscle like immobility where they're not really working. They're like paralyzed is a little bit of an exaggeration. I would definitely refer to your notes and talk to the teacher that taught it. And if you're still not understanding, and or if what I said you don't agree with, definitely email me. But this is what it usually comes up to be, that it is stage one non-REM.
No, yeah, because like, man, I'm looking at the notes right now, and it says like stage one non-REM is like it's the lightest sleep.
It is. And that's why you'll have some muscle jerking. You're easily aroused from it, woken up.
So basically it's that one because there's muscle tone present.
Mm-hmm.
Okay. Thank you.
You're welcome. Let me. Nurses providing an oral medication for pain relief to a client to attain the fastest pain relief. The nurse administers the medication so it is most rapidly absorbed from the gastrointestinal GI tract which mode of delivery has the fastest absorption? A, tablet, B, enteric, C, capsule, or D, liquid? And the poll. And it's D, liquid suspension. Drugs must be in solution to be absorbed in the gastrointestinal tract. Thus, solid forms must be able to disintegrate and degrade. Because liquid drugs are already in solution, they are absorbed faster than drugs in a solid form.
Sorry, could you just show the options one more time, real quick?
Sure. There you go. Tablet, enteric, which enteric doesn't even absorb in the stomach. Capsule or liquid, so it was liquid.
Okay, thank you.
You're welcome. Client asks why the oral dose of pain medication is higher than the intravenous dose. The nurse explains that with oral dose, only 20%, 20 to 40% of the drug may actually enter the systemic circulation, and this reduces the amount of active drug. What is the term for this effect? A, protein binding, B, bioavailability, C, hepatic first pass, or D, pinocytosis. Sorry. So the answer is B, which most people did pick. Bioavailability is the percentage of the administered drugs during that reaches the systemic circulation. The administered drug dose. Nurse is reviewing the client's newly written medication order and is unable to read the prescriber's handwriting. Which of the following actions is most appropriate? Confer with another nurse who is more familiar with the prescriber's handwriting. Send the order to the pharmacy for accurate inspection. Contact the prescriber to clarify the order. Disregard the order until the prescriber returns to the unit. If anything you see here you feel is contradicting what you were taught, please talk to that instructor. But please contact me if they didn't agree with my answer. Last semester I did have all of the instructors have changed, but I did have all the instructors read the questions and answers to make sure that they agreed with the answer. So that's something I would definitely want to know. And I know that would happen when I was a faculty member. which is very frustrating for students. And to be honest, why I took this job after I retired. So you'd want to contact this prescriber to clarify the order. Because I would actually, my phone and email would blow up after SIPN with students fretting about what the answers were on the SIPN slides. So I made loads of changes. A nurse is completing discharge teaching for a client who has a new prescription for transdermal patches, which statement indicates the client understands the instructions. I will clean the site with an alcohol swab before I apply the patch. I will rotate the application sites weekly. I will apply the patch to an area of skin with no hair. I will place the new patch on the site of the old patch. I have to, no, I already did do that. Pull. Now, the other thing I think what you do want to do when you go through these slides on your own, what you want to do is go through and identify what is wrong with each of these answers that are not correct, reword them to make them correct, and like try and make the slide a select all but apply, because they're the ones that people are most intimidated about. I'm going to end the poll. So the answer here is C, that you're going to apply the patch to an area of skin to promote absorption of the medication, hairless area. Let me see here. You're not necessarily going to clean it with alcohol. You do want it to a clean area. It may be just alcohol is very drying. So even just soap and water. You really want to clean whenever you remove a patch. So that area should be clean. You rotate the application sites whenever you're applying the patch. So it's not just weekly. And you don't want to place the new patch on the same site where the old patch was. What was the question?
Right. So now I'm confused though, because you're saying you don't want to place the new patch on a site where the old one was. So B kind of would be correct because it says I will rotate the application sites.
Right.
So but the answer said the answer was C.
Let me go back.
But you have to rotate the application site every time you put a new patch, not just
Oh,
weekly.
Oh,
B
because
says weekly.
Okay.
B, that's the key word here. B says weekly every time. So you just move it over some. Or if you're doing the chest, you do the opposite chest. There are some there's one for dementia that you put on the person's back, and they actually have like a chart that goes with it. And basically, you start at maybe the upper left-hand shoulder of the back, and you move over the size of the patch every time you put a new one on. Does that make sense? And if it were on an arm, like a different part of the arm, you don't want to put it where it was. But you're not rotating weekly. Weekly was the key word there that knocked that answer out. Okay?
So you said A was wrong because of the alcohol swab?
Yeah,
Okay.
it was.
Does that mean that you don't necessarily have to like use alcohol swab when you apply a patch?
You don't have to. Soap and water works just as well.
Okay.
It's not like you need to prep the skin for it with alcohol or anything. When a nurse is administering a medication to a confused patient, the patient says, "This pill looks different from the one I had before." Which should the nurse do? Ask what the other pill looked like. B, explain the purpose of the medication. C, check the original medication prescription. And D, encourage the patient to take the medication. And the poll. So the answer is C, because it's going back to the original source of the prescription. Whenever there is any question, you go back to the order, okay? Now, A, like, what did it look like? I mean, that is something that you may ask, but, if the patient is confused, the information that you get from that patient may be inaccurate. And so you don't always, I'm not going to say you don't always know if they're confused, but if they're getting pain medicines, it's almost like they're under the influence a little. Okay, so if they've had a pain medicine and then they got a regularly scheduled med, they may be remembering it wrong. Just going ahead and saying, well, this is what it's for, really just ignores that patient's concerns. I mean, you do want to do that. That is very important. But when it comes to this question, it's not addressing the patient's concerns. So it's not what we're calling the priority action. And then D is just flat out not safe. Is this helping you guys or making you more nervous because you're not knowing as much as you thought? So here we have
Definitely more nervous.
Okay, well, the one thing I want to remind you is that it's Friday. And normally I'll be doing this on Wednesday, which is more nerve-wracking if you're not knowing it, but it's between 1 and 3. So think about, this is even before the weekend. So think about all that you will be studying this weekend and how that will clarify things. So it's good that, okay, you're getting nervous, like, holy cow, there are things I don't know. I would love to be doing this like on a Monday, after a weekend of study. The reason I can't do this Monday or Tuesday like I'd like to is that, everyone's in a different clinical group. So there's no time that works for the day and the evening clinical group. So that's why Mondays and Tuesdays are out, or I would have done it next week. Wednesday, I'm trying to do it early enough that you still have enough, you've studied before you come into this on Wednesday, and you have enough study time afterwards on Wednesday to continue studying. And some of these will maybe make more sense after lab. Others, lab is not going to help you at all for them because they're not what's practiced in lab. So when a nurse administers an incorrect dose of the medication to a patient, which of the is the primary purpose of documenting this event on an incident report? Do you want to record the event for future litigation? That's A. Do you want to B, provide a basis for designing new policies? C, prevent similar situations from happening again? Or D, ensure accountability for the cause of the accident? So the answer is C. It's the risk management committees actually use the data about accidents and incidents to identify patterns of risk and prevent future accidents and incidents. So that's the primary reason. D, some people put, although nurses are always accountable for their actions, accountability for the cause of an incident is the role of the courts. In preparing to administer a medication, the nurse identifies that the dose is larger than the standard dose recommended by the manufacturer. Which should the nurse do? A, inform the supervisor. B, give the drug as prescribed. C, give the average dose of the medication. Or D, discuss the prescription with the primary healthcare provider. Now, this is, you need to be able to recognize the fact that a dose is larger than the standard dose. So that is actually why you are doing your medication sheets, and they include what is the routine dose of this. And then if your patient is outside of the routine dose, you can actually go and look it up again and see if it discusses maybe other doses that you didn't have on your paper, like doses for renal failure or things like that. I'm going to end the poll. So not everyone is taking advantage of the poll. I'm getting about 22 to 24 responses out of the 30 people. I don't know if you would be willing to share in the chat why you're not doing it, but I'm just curious. Why not do the poll? And because it is a matter of, making a decision. So D was the answer. Nurses have a professional responsibility to know or investigate the standard dose for medications being administered. In addition, nurses are responsible for their own actions regardless of whether there is a written prescription. So the nurse has the responsibility to question and or refuse to administer a prescription that appears unreasonable. Does that make sense to everyone?
Yes.
So you may have to refuse to give a med or call someone to clarify it. They may have left a decimal point out.
And so these, like, are we seeing these mishaps just because we're familiar with the med? We start to become familiar and we know that that's a higher dose than normal, or is this something that we can see when we scan it in that is higher than a normal dose?
You'll be able to see it right on the MAR. So when you go to the hospital, you'll see the MAR and
Mhm.
it has everything written on there.
Okay.
So prior to ever, like if I taught students, you go in, you take a look at the meds and make sure that they all make sense, the doses are appropriate and all of that when you first get there.
Mhm.
And at that point, you have the opportunity to check that med and see, wow, this dose looks really high, and I want to call the prescriber. I'm going to try and understand why this dose is so much higher than it should be. Okay. So you don't have to wait until you scan it. You'll see it right on the MAR. And you should be seeing MARs during lab. And you should have, did you see one during class?
Yeah.
Okay. That's what they look like, at least through Christiana Care. I had created all those. When a nurse attempts to administer a medication to a patient, the patient refuses to take the medication because it causes diarrhea. The nurse provides teaching about the medication, but the patient continues, admittedly, to refuse the medication. Which should the nurse do first? Document the patient's refusal to take the medication, discuss with a family member the need for the patient to take the medication, explain again the patient the consequences of refusing to take the medication, or notify the healthcare provider of the patient's refusal to take the medication. Cool. So the big keyword is first. I'm going to end the poll. So the answer is A, withholding the medication and documenting the patient's refusal are appropriate interventions, and the patients do have a right to refuse, but then you would notify the primary healthcare provider, and it should eventually be done. Okay. Discussing it with a family member without the patient's consent is a violation. And yes, the patient does need to be taught about the medication, and but if they adamantly refuse the medication, further teacher at this time may be viewed as badgering. So just make sure that you've explained it well, the consequences. Nurse instructs the patient to close their eyes after administration of an eye drop. Which rationale for the instruction should the nurse explain to the patient? Limits corneal irritation, A. B. Squeeze excess medication from the eyes. C. Disperses the medication over the eyeball. And D. Prevents medication from entering the lacrimal duct. I'm getting ready to close the poll. Everyone put C. And you're right. So you're right. The gentle pressure over the inner canthus for a minute is going to prevent medication from entering the lacrimal duct, but that is not the same as closing their eyes moves the medication over the conjunctivae and the eyeball and helps to ensure that that medication gets distributed equally. Now, I wish I had numbers on this. I'm getting nervous. Hey, I don't know what slide this is out of my slides. I may end up running over. I don't know. A primary health care provider prescribes a medication that must be administered via the intramuscular route. Which site should the nurse eliminate from consideration because it has the highest potential for injury when administering the intramuscular injection? So I know you haven't really learned this yet. A is vastus lateralis, B is rectus femoris, C is ventrogluteal, and D is dorsogluteal. So I'm going to end the poll. I know you haven't really learned it. And the answer is actually D. There were a few people that did put B. So D is actually the dorsal gluteal site has the highest risk for injury because of the close proximity to the sciatic nerve and blood vessels in the bone. And this site essentially is no longer used. This was the prime site when I was in nursing school. It's basically the buttocks up high in the hip, but it is on the buttocks. And we had to withdraw at that time to make sure we didn't have blood. And now they don't withdraw to check for blood anymore. And it's basically because these other sites are not as close to main blood vessels as this one was. So if you are in the hospital and you see people putting them in a site, would usually be an older nurse. Please don't follow in that nurse's footsteps.
So,
Only do the
question. So
yes,
you're saying like we didn't go over this yet, right? This is still going to
right.
be exam one,
It
or
is.
oh
It
wow.
is on exam one. So you really want to study this stuff hard. You have a worksheet you need to do for lab on Monday, right? All about injectables.
Yes, it's a pre-class assignment. And this was in the medication, some of it was in the medication administration, the injectables module on ATI.
Right. Go through that and take a lot of time doing that and trying to understand it. Do not go to class without that done because that is you studying. And the more you know going into your lab, the more that you're acting it out and reviewing it, some of it during lab, okay? So here's another one. Which information about parenteral medication indicates that the nurse should use a filtered needle when preparing the medication? It has to be reconstituted. It is supplied in an ampule. It appears to be cloudy in the vial, or it is to be mixed with another medication. And I'm going to kick this, off quick, just because I know you haven't learned it. Most answers are hitting at the ampule, and that's correct. So it has an ampule, right? and you are going to use a device, usually not a device, usually it's an alcohol swab though. There is a device, but to break that ampule open. And the concern is that there are glass particles in that ampule now that fell that maybe you can't see, but they could end up drawn up into the syringe. So